Hi, I'm Amy and I'm one of the midwives here at BHRUT. In this video, I'm going to talk to you a little bit about your anatomy and a little bit about the science behind labour. So first of all, we're going to talk a little bit about your pelvis. So this is the front of the pelvis, what we call the pelvic arch, and this is the back of the pelvis. Pelvis is made up of 3 bones, one here, and one here. And in between those bones, we've got our ligaments. Now, during pregnancy, and more so during labour, your body releases a hormone called relaxin, and it does just that. It relaxes the ligaments and bones so that they can move to accommodate your growing uterus and to allow the baby to pass through. Then you've got your uterus. Your uterus starts off really tiny. It's like even smaller than my fist, and it sits right here at the front of the pelvis. During pregnancy, as you know already, that grows and grows and grows until under your ribs. And there's also some ligaments that are joint to the pelvis that are supporting your uterus, which is shown by the wonderful balloon. So if you can imagine, this is your uterus, this is your cervix, which is actually the opening of your uterus, and this is the part that changes and opens to allow the baby to pass through, which we'll talk about in a bit more detail soon. Then within your uterus, or as some people call it, the womb, you have your amniotic sac. Now, your placenta is actually attached to your amniotic sac on one side, which we call the fetal side, and you can see the umbilical cord is there, which is attached to the baby, and that gives the baby everything it needs, all the oxygen and all the nutrients it needs to survive and to grow. And then the other side, which is actually attached to the womb, and we call that the maternal side. So if you can imagine, this side is attached to your uterus, and then the baby, my lovely baby here, with the umbilical cord attached, is inside the amniotic sac with all the amniotic fluid tucked in nicely in a good position. And then that sits within your uterus. Now, did you know that that baby actually dictates when you're going to go into labour? So as I said, the baby's getting everything it needs, all the oxygen, all its blood supply, all its nutrients from the placenta and the umbilical cord in utero, in the uterus. So the baby's lungs aren't actually being used yet. So they're the last thing that matures before the baby comes out. So when the lungs are ready to breathe on the outside world, they release a hormone into the amniotic fluid called fibronectin, which sends a message to your brain and tells you, we're ready, let's start this. And that's when labour starts. So now I'm going to talk a little bit about the cervix. Some massive changes have to occur here so that your baby can pass through. It starts off long and thick and is positioned quite far back. During labour, the latent phase, early stages of labour, quite a lot happens. It becomes anterior, so it tilts more forward, so it sits more at the front. It thins out, which we call effacement, and it opens, which is what we're referring to when we say how dilated you are. This short video shows cervical dilation using an orange. Your uterus is an amazing muscle. Our midwife guru, Ina Gaskin, explains if men only had one, they would totally brag about it. It grows from being really tiny, like I explained before, all the way up to your ribs. So during labour, your uterus contracts. It has different layers of muscles helping it to do this. Muscles going this way and muscles going this way. And what that's doing is it's helping to encourage the baby down as it's contracting, so squeezing, and it's helping that the cervix make those changes we talked about before and open to allow the baby to come out. Contractions are positive. We welcome them and we want them. You have to remember your body is doing exactly what it's designed to do. We need to use them and we need to work with them. For any muscle to work effectively, what does it need? It needs oxygen, and the uterus is no different. So now I'm going to do a small exercise with you to explain how oxygen is so important for our muscles. So you're all going to think I'm mad, but please try this with me. I want you to get your hands like this and just open and close them. And realise how easy that is and how effortless that is, just to open and close your hands. No problem, no pain, just opening and closing your hands. Now what I want you to do for a full minute is raise one of your hands above your head. And I want you to keep opening and keep closing your hands. And just feel what's happening. There's no pain, it's really easy. We're just opening and closing your hand. And make sure it's above your head. We're going to keep going, and just feel the different sensation now. Starting to get a tiny bit achy maybe, bit more effort put in. Keep going, open and close. Mine's starting to feel a bit tingly now. It's definitely more of an effort to keep going. But we're going to keep going for a whole minute. Definitely slowing now. Definitely more achy. Nearly there. Might start to feel a bit more tingly now. Definitely an effort to keep opening and closing your hand. That's it. That's a full minute. Ooh. What you can see there, or what you can feel there, is that your hand becomes quite achy and it's quite hard to actually open and close your hand. And that's because your blood supply is going down your arm and going away from your hand. So there's no oxygen there. Every muscle needs oxygen to be able to work effectively. And for your uterus to work effectively, you need to be able to give it that oxygen. And the best way to do this is by learning to breathe properly. Learning to breathe properly can help your uterus gain the oxygen it needs to work efficiently. If you panic and you lose focus, your body goes into survival mode, so that's fight or flight mode. And your oxygen is then sent to your major organs, the organs you need to survive, so your brain, your heart, your lungs. And it's not giving that oxygen supply to your uterus, but your body is still going into labour, but nothing is working properly. So those muscles that I talked about going up and going round normally work effectively together. And when there isn't enough oxygen, they're not working together. One's going there, and it hurts more. That's why it's so important to use the breathing techniques that we're going to explain in another video, and it makes it all a lot less painful. It also gives the oxygen to the baby. The baby needs the oxygen too. So now using the balloon and a ping pong ball, I'm just going to explain how the contractions work. So when you get a contraction, as I explained, those muscles are doing what they need to do to help move the baby down and to help those changes occur with the cervix and help it open so the baby can move through. And what a contraction is and what it feels like is slightly like a period pain. So you'll feel that to start with. It will get stronger and it will get stronger. And what's happening is the uterus is squeezing like this. And what happens is it starts off quite low and it gets stronger and stronger and stronger till it peaks. And it peaks for about 20 to 30 seconds and then it releases again. The whole contraction is around 50 to 60 seconds. You have a few minutes in between the contractions and then you go again. So you start to feel it building, it's building up, and then the peak, it squeezes, all those changes are happening, it's happening for a reason, and then it slowly releases again. And what you can see is every time a contraction happens, the cervix starts to shorten, it starts to thin, and it starts to open. Use your contractions. Breathe with your contractions. Feed your uterus the oxygen it needs. So as you can see, the cervix is thinned out, shortened, and opened. So now I'm going to talk a little bit about the science and your birthing hormones. So your body makes a wonderful cocktail of hormones to prepare your body for birth, feeding, and bonding. The hormones start the contractions, they prepare baby for birth and life on the outside world. The hormones enable us to have a successful and efficient births so that we actually want to do it again. The first hormone I'm going to talk about, which you've probably heard about before, is oxytocin, We refer to this as the love hormone. It's released when we feel relaxed, loved and protected, when we hug, when we kiss, or when we make love. We can't actually labour without it, and it's what we give birthing women when they're having an induction. We give them synthetic oxytocin. Oxytocin triggers the start of your contractions and the start of your labour, and you can get a rush of oxytocin during sex. And when I say this, I mean good sex, consented sex, sex where you have an orgasm. Lots of people try and have sex to induce labour, but it's only going to work if you have an orgasm and release the oxytocin, not just to get the job done. Oxytocin is released during birth and breastfeeding, and a constant release of oxytocin is needed for birth to continue and progress naturally. It helps promote the hormone prolactin, which causes us to lactate, and in turn the baby sucking on the breast also causes the uterus to contract. This reduces bleeding and helps the placenta detach from the womb. Oxytocin also helps mum and baby bond together. It can reduce stress both in mother and baby, and it makes mum feel happy. Unfortunately, fear or adrenaline will reduce oxytocin. That's why it's important to try and stay relaxed and in your oxytocin filled bubble. This is why it's so important to know how to work with oxytocin to help a birthing person stay in their oxytocin filled bubble during birth and when the baby has arrived. A rise in oxytocin following the birth of the baby triggers the body to expel the placenta and close the birthing process. Unfortunately, low levels of oxytocin can cause our contractions to slow or to stop. Lack of contractions can cause the placenta detaching from the uterus to slow down. This can cause an increase in bleeding after the baby's born and can lead to further medical attention. It can also reduce our breast milk production. So how do we stimulate oxytocin? We want to give our bodies as much oxytocin as it needs, and we want the supply to keep coming. So we need to feel safe, we need to feel calm and comfortable, loved and protected. It helps when you're not being disturbed without people watching over you, just like when you're doing a poo. If someone's staring at you while you're trying to do a poo, it becomes a very stressful situation. Your body will tense up and it's harder for you to do that poo. But if you're relaxed, you chill out, you're reading whatever you're reading, your phone, the shampoo bottle, it's a lot easier for you to do a poo. It's just like that. Low lighting helps, feeling cosy and protected. Nipple and clitoral stimulation can also help. This is not advised when your waters have broken. Familiar smells, sounds and visuals that make you happy can also help. And this is why we tell you to take things into the birthing room that make you feel happy and make you smile, such as positive affirmations or smells that remind you of home. We always say hugs before drugs. So next hormone I'm going to talk about is endorphins. Now endorphins are a euphoric hormone. It gives you a natural high and lots of wonderful feelings to make you want to give birth again. They are our natural pain relief, and they're released when you feel pain or stress, but your body can store these hormones and then use them when they need them. Studies have shown that natural endorphins drop if we have an epidural or we use opioid pain relief, and this is just because the signals to the brain isn't the same and they're slightly blocked. It can also help manage baby blues following the birth of the baby. The next hormone I'm going to talk about is adrenaline. Now adrenaline is released when we get scared. It's our response when we are scared and we go into fight or flight modes. So we either fight the situation or we flight, we run away from it. Unfortunately, adrenaline and oxytocin do not go well together, and adrenaline can actually stall birth. So early in evolution, basically before we were all housed and clothed and when we were cave people, adrenaline was needed to stop or slow labour. So if a birthing person was in labour and a saber-toothed tiger came along and they felt threatened, the adrenaline would kick in, stall the oxytocin, they could move to a place where they felt safe, and the oxytocin would then take over again and they can birth their baby. Relaxation and breathing techniques can help manage adrenaline by making us feel more calm and relaxed and allow the oxytocin to carry on and do its thing. There is one point in birth where we do expect adrenaline to come, but when you know about it, you can use it and you know it will pass. This point is called transition, and transition is a normal process of birth. Your body's given you an extra oomph of energy using adrenaline, ready to birth your baby. It's normal then to start to feel a little scared or to doubt yourself. But for a midwife, it's actually quite an exciting time because we know you're so close to birthing your baby. Some reassurance from us and from your birth partner can make a massive difference. And before you know it, this phase has absolutely passed. Now I'm going to talk a little bit about the different stages of labour. So first of all, we've got the latent phase, also called early labour. And this is when the cervix is making small changes, as we discussed earlier. So your cervix is changing position, it's thinning out, and it's opening, dilating. You may find you have some contractions here. They may start to feel a little like small cramps or period-like pains, and you may be a bit unsure and think, oh, what was that? Was that a contraction? Was it not? But slowly and surely they'll become stronger and they'll start to become a bit more regular, and then you know that you're in labour. Make sure you stay active during this phase of labour, and this will encourage your baby into a good position for labour and birth. But also make sure you're getting some rest between contractions, especially if it's night time. Keep well hydrated, but always remember to pee. Have small snacks in between your contractions and make sure you've got a good supply in your birth bag too. This will help keep your body well fueled for labour. Then we have what we call active labour. So the medical model explains active labour to be from 4 centimetres dilated with strong regular contractions. So we describe this around every 3 minutes. Contractions will be strong enough that you won't be able to talk through them, but you will be able to use your birth breathing and your relaxation techniques that you'll learn in another video. The first stage of labour is basically from 4 centimetres dilated until you're fully dilated. The second stage of labour is the birthing stage, or some people call the pushing stage. And the third stage of labour is the delivery of your placenta, which we will discuss in more detail in another video shortly. So now I'm going to talk a little bit about the golden hour and skin to skin. So once you've birthed your baby, either vaginally or abdominally, your baby will be given straight to you to start skin to skin. The baby is placed naked onto your bare chest and you're both wrapped up together for your first cuddle. We sometimes refer to this as the golden hour because so much is happening during this time. You instantly sniff your baby's head, which releases oxytocin and endorphins, which helps you bond with your baby. The release of oxytocin triggers prolactin, which initiates the lactating process. Skin to skin regulates your baby's temperature, it keeps them warm, it regulates their breathing and their heart rate, so it can be quite an important tool to use. It also reduces stress in the newborn and it helps protect the baby from infection, as they are then covered in mum's good bacteria, which sets them up for life. Some babies will even do something called a breast crawl, where they literally manoeuvre themselves over to the breast and initiate their first latch. And this is because your nipples, as you've probably noticed, become darker and easier for the baby to see, and they smell like amniotic fluid, which is one of the smells that the baby is familiar with, so it's attracted to them. It's all really, really clever, and everything is connected. Your midwife can carry out the baby's initial checks whilst you're skin to skin with your baby. If they need to move the baby for whatever reason, they'll explain why. If you can't have skin to skin straight away following your birth, you can always do it at a later time. Dads can also get involved. It's also a great way to soothe your baby for the first month or so of life, so you can do it at home too. You can have skin to skin following an elective section and sometimes following an emergency C-section. Just ask your midwife.